Hi, I'm Vicky. I am a lecturer in pharmacy practice. I am also a pharmacist working at the Royal Berkshire Hospital. So you'll be seeing me when you come on your placements there. And today I'm going to talk to you about respiratory conditions that you're likely to see in your community pharmacies. During your career, you will need to deal with respiratory conditions, and of course you'll need to know it for the exam. The aim is to provide an overview of common respiratory conditions encountered in community pharmacy and look at the different treatment options available. We'll use structured questioning to differentiate between respiratory conditions based on the patient's symptoms and history. Think about the sort of questions that you want to ask to get the information that you need to be able to make those decisions. And describe the appropriate management of respiratory conditions with over-the-counter products and or non-pharmacological interventions. So again, thinking about what products we're going to recommend and what general advice we can give patients on top of that. This should just be revision, but the respiratory system is complex, and depending on what part is affected will depend on the symptoms that are seen. We are going to look at 4 main respiratory conditions: the common cold and influenza, coughs, sore throat and hay fever. Looking first at common colds and influenza. Are colds and flu the same? And if not, what's the difference? There are over 100 viruses that can cause a cold, and on average, people will have 2 to 4 colds a year. Flu is much more rare. Colds tend to affect the upper respiratory tract, but flu affects the whole respiratory tract. Flu can worsen long-term medical conditions such as congestive heart failure, asthma or diabetes. Transmission between the two is similar, droplet, so it's transmitted via sneezing, coughing, or it can be inhaled directly or passed on to surfaces and then passed on to fingers. Complications of influenza include viral or bacterial pneumonia, dehydration and ear infections such as sinus infections, particularly common in children. This is just a picture to help you visualize the differences between flu and colds. Headache is normally due to inflammation and congestion. With the nose, initially with congestion, the nose has a sort of clear and watery substance, and then over time develops into a thicker substance. And this is due to dilation of the blood vessels, leading to swelling of the lining of the surfaces, narrowing nasal passages, further blocked by mucus. Flu has more of a sudden onset and can give you shivering, headache, myalgia, which is muscle pain, back pain, and is then followed with a cough and nasal congestion and sore throat. Of course, now we also need to consider COVID. The main symptoms still are cough, fever, and loss of taste or smell. Thinking about our WHAM questions with cold and flu, what do we specifically want to find out? Who is it for? Children are more prone to upper respiratory tract infections, and adults can get more complications, particularly those who are older or frail, who have more comorbidities or at risk of complications such as pneumonia. The symptoms, were they rapid onset, such as in flu, or were they more gradual, which is more common with colds? Have they had any contact with anybody who has tested positive for COVID-19? Do they have a runny nose, a blocked nose, a cough? Are there any signs of temperature? How long have they had the symptoms? So colds will typically last about 4 to 7 days, whereas flu can last a lot longer. Have they tried any medications? It's always best to ask this question up front. Otherwise, you might go ahead and recommend that they have paracetamol, and then they might turn around to you and say, oh, I've used that. And then you could say, oh, well, how about trying a lozenge? And then again, they could turn around and say, well, I've tried one of those and it hasn't been affected. So think about the confidence of the patient in you by the questions you are asking, and trying to find out as much information as you can before you make any recommendations. Does the patient take any medications? We need to look out for interactions between medications, and obviously finding out, is anybody else that they live with unwell, or have they had close contact with anybody who has tested positive for COVID-19 recently? Looking at when we need to refer, is there any chest pain? If there is, this could be a cardiac event, so something like a heart attack or myocardial infarction. Is there any shortness of breath? This could indicate something like pneumonia, or maybe the patient has chronic obstructive airway disease, COPD, and this is irreversible narrowing of the airways, causing shortness of breath, or maybe asthma. Is there any wheezing present? Asthma is an inflammatory condition causing narrowing of the airways, which can cause cough, wheezing, and shortness of breath. Are they coughing up any sputum? And if they are, what is the nature of that sputum? Is it green? Is it yellow? Is it brown? Because those could indicate infection. Is there severe pain on coughing? This could indicate something like pleurisy, or maybe even a pulmonary embolus, which is a blood clot on the lung. Is there any neck stiffness? This could indicate something like meningitis. Nighttime cough, particularly in children, might indicate asthma. And if there's any earache not settling with analgesia, this might indicate an ear infection. We need to ask the right questions to work out what could be causing the symptoms. For example, shortness of breath. Is it always there, or is it a recent thing? Asthma, inflammation causing reversible narrowing of the airways. The symptoms include wheezing, coughing, chest tightness, and shortness of breath. Could it be COPD, chronic obstructive pulmonary disease? This is irreversible narrowing of the airways, including chronic bronchitis and emphysema, and is characterized by an increasing breathlessness. Could it be TB, tuberculosis? This is a bacterial infection spread through inhaling tiny droplets from coughs and sneezes of an infected person. TB mainly affects the lungs. Symptoms include a persistent cough that lasts more than 3 weeks and usually brings up phlegm, which might be bloody. There is breathlessness, which gradually gets worse. Meningitis is an infection of the membranes protecting the brain and spinal cord. Symptoms include a high temperature, fever, headache, aching muscles and joints, and breathing quickly. Cold hands and feet, a stiff neck, confusion, and a dislike of bright lights, or fits or seizures can also occur. Pneumonia can cause swelling and inflammation of the tissue in one or both lungs, and it's usually caused by a bacterial infection. At the end of the breathing tubes in the lungs are clusters of tiny little air sacs. If you have pneumonia, these little air sacs become inflamed and fill up with fluid. It could be a cardiovascular problem such as heart failure, leading to shortness of breath. Treatment is based around relieving the symptoms, so congestion, the runny nose, the sore throat, the high fever and cough. really depends on what the problematic symptoms are for your patient. Day and night nurse is a combination pack containing 2 types of capsules. The orange and yellow day nurse capsules contain 3 active ingredients: paracetamol, pseudoephedrine, which is a decongestant, and also fulcodine, a cough suppressant. The green and white night nurse capsules also contain 3 active ingredients: paracetamol, promethazine, which dries up nasal secretions to reduce the runny nose, and it also causes drowsiness, and dextromethorphan, which is a cough suppressant. Children aged 6 to 12 you'll need to limit treatment to 5 days. Decongestants work by constricting nasal blood vessels. The nasal membranes shrink and then the circulation of air improves. They're available in oral or topical preparations, and rebound congestion can occur with both formulations. Oral decongestants such as pseudoephedrine and ephedrine have stimulant effects, so they keep people awake and they can stimulate the heart, increasing the blood pressure and also blood glucose levels, and therefore should be used with caution in people with diabetes, high blood pressure and hyperthyroidism. They shouldn't be taken near bedtime because they are a stimulant, although having said that, if you use topical preparations, these effects are likely to be less. The topical preparations can last for up to 6 hours. All decongestants have interactions with some antidepressants called MAOIs, or monoamine oxidase inhibitors. They're available in small pack sizes, and after 7 days use can make congestion worse, so we limit supply for 7 days. There is possible risk of extraction of ephedrine and pseudoephedrines from products to be used to make crystal meth, so you need to be aware of this. Antihistamines theoretically reduce a runny nose and sneezing through an anticholinergic effect, but they are not so effective. There are 2 types of antihistamine. You have your sedating antihistamines and your non-sedating antihistamines. They are normally contained in combination products. They can cause a dry mouth, blurred vision and constipation, and they should be avoided in those with closed angled glaucoma. Some non-pharmacological advice: explain that this is caused by a virus. There is no point in going to the GP for antibiotics, as antibiotics are effective against bacteria and this is not a bacterial infection. Inform patients that symptoms should improve within 7 to 10 days. Rest as much as possible, keep warm and have plenty of fluids. Eat lots of fresh fruit and vegetables to help maintain the body's vitamins and minerals. And you can use things like steam inhalation, where breathing in warm, moist air can help with the nasal congestion. Not boiling water due to risk of burns, but warm, moist air. Wash hands frequently and also avoid sharing towels and sharing toys to reduce transmission. Some might want to look at more natural remedies to treat cold and flu, but it can be hard to find the evidence behind use of these. So you're working in your community pharmacy and a 52-year-old man comes into your pharmacy asking for something for flu. He has, on questioning him with your WAM questions, you find out he has a runny nose, a sore throat, he feels a bit achy, which started yesterday. He does not have a high temperature. You know him well as he is a regular customer at your pharmacy. You know he takes a prescription-only medication for COPD, chronic obstructive pulmonary disease, and he also has hypertension, and he hasn't tried any medication yet for his flu. Have a little think now about what recommendations that you might want to make, and then we'll go through this in part 2.